Okay, I think we can get started. Let's see. Nobody seems to have any problem hearing me. Okay. Good afternoon, everyone, and thank you all for joining on the interwebs for our first online Minerals to Metals forum. Just some quick housekeeping. Please mute your mic and turn off your video. During the discussion, either type your question in the chat box or raise your hand before unmuting and speaking to the group. Some new people are coming in, sorry. Let's see. Okay. There we go. Now I think everyone is in. Okay, just for the housekeeping, keep your mic off and video turned off. Just so that we're not speaking over one another. Please note that this forum is recorded and will be made available to you through the Minerals to Metals and Mineral Law in Africa websites. If you don't want to be seen or heard, but you do want to participate, please note that you can make yourself anonymous by changing your name and leaving your questions in the chat. If you have any issues, please send me a private message in the chat and I'll try and assist as best I can. And now, without further ado, I am pleased to introduce our panelists who will all speak about the impacts COVID-19 has had on the mining sector in South Africa from various angles. First, I would like to thank our speakers from the Minerals Council, Mr. Tebello Chabana and Dr. Thuthula Balfour for joining us this afternoon. And a big thank you to you, my colleagues from the Mineral Law in Africa team, Mr. Richard Cramer and Mr. Gaopalelwe Mathiba for presenting their work on the COVID-19 crisis. Mr. Chabana, the Senior Executive for Public Affairs and Transformation from the Minerals Council, will give an introductory address on the impacts of COVID-19.
Thank you very much. Thank you for this invitation to come talk to you. What I just wanted to say just before I start is, well, just to give a very brief introduction on who or what the Minerals Council is. We're an advocacy body representing mining employers in South Africa. We have about close to 80 members, member companies, direct members, and indirectly through associations, some 600 odd, close to 500 odd numbers, additional members, smaller companies through the associations. We currently represent about 90% of South Africa's mining production by value. So we certainly do represent a substantial portion of the mining sector. So I'll give you this overview, but in order to do so, I've got to talk a little bit about the mining sector so you do understand it. My colleague, Dr. Balfour, will really go more into the details of how this is impacting from a health perspective and what we're doing. So that, a large chunk of my presentation will be missing essentially, but will be dealt with by Dr. Balfour. So we must remember that the mining sector is a key foundation industry in the South African economy, and its linkages are profound. They have a profound multiplier impact in all the areas of the economy. Mining generates 18% of GDP, 8% directly, about 1.3 million jobs, 453,000 directly, And quite importantly, 45% of our exports, so the cash flow for the economy, and primary metals alone make up about 25% of that. We make up about 20% of private sector investment and 11% of that directly. I think we're paying about, we're contributing about 70 billion to the fiscus.
Sorry to interrupt you. Could you potentially turn on your video? There we go. I'm going to start it for you. Okay, sorry about that.
No worries. Can you hear me now? Can you see me?
Perfect.
Fabulous. Oh, and I was just saying, so we are also quite intricately linked to the functioning of the South African local government, i.e. metropolitan and rural, in fact. We paid 135 billion in wages, spent about 400 billion on procurement of goods and services and capex, and we generated some 600 billion rand income for the economy. We make up about 80% of Transnet freight rails volume and about 50% of their overall revenue. So as I basically said, I mean, mining is a significant source of primary income for the South African economy, and based on the GDP multiplier of 2.7 times, we create significant economic activity in the economy. So we say, when mining does badly, the whole economy is affected. So when we were hit with COVID-19, we built a 10-point action plan. Which is essentially a risk-based model of mitigating the impact of COVID-19. This has been implemented by all members and is fully synchronized with the DMR principles, DMRE's principles. Now, Dr. Balfour will talk to that a lot more, so I'm not going to deal with those things specifically. Just bear that in mind, she will deal with that. Excuse me. So essentially based on our risk-based model and working closely with government, certain parts of the mining sector were declared essential services, such as coal smelters, the coal producers, smelters and refineries, and other components of the sector were able to apply for exemptions, provided all the preventative and mitigation controls were in place, and also to reduce employee numbers and also not allowing any more than 50% production to continue. You must remember, just to give you an example, with coal, I think it's over 90% of our electricity is generated through coal, 30% of our liquid fuels. So these things, it was essential that some of these mining operations continue. I mean, some of our platinum even is utilized in medical equipment and some of our chrome. So the uses of our products actually quite broad and quite essential. So what has actually happened as a result of the pandemic? All deep level labor intensive mining operations are on care and maintenance. They've essentially stopped. We're talking about the production of your PGMs in South Africa and also gold. Apparently about half of our iron ore production is operational. There is no manganese or chrome production taking place, if I'm not mistaken, but there might be an exception here. I think I'm aware of the one exception. I won't mention the company's name as such. Diamond mining has pretty much stopped. And I think coal overall, about 50% of the coal mines are in operation. Some smelters and refineries have continued operating using surface material. There are some surface PGM and gold producers operating at reduced levels. So we don't have the exact number as yet, but we estimate that by far the majority of the industry is on lockdown. We estimate that about 70% of our employees are certainly not at work, but are still getting paid. The wage cost alone for this lockdown period is estimated to be about 7 billion rand. Our estimates of mining production that will be affected, we're looking at about 20% decline in production in April, and at the moment we're looking at about 4.5% for the year. Now, we must remember that mining has very high fixed costs. I think on a weighted average basis, 50% of our mining costs are fixed costs, and they range clearly from industry: copper mining 25%, gold mining up to 63%. And yes, theoretically speaking, these variable costs can be paused during a shutdown, but the fixed costs cannot. The capital intensive nature of mining operations require us to be continually producing according to a set production plan to dilute these costs. Therefore, the stoppages have a seriously detrimental impact on the financial viability of mining operations, as they are highly capitalized. I also want to just talk a little bit about the leverage. The mining sector is also pretty highly leveraged. Our leverage ratio is at about 1.7 times, in that liabilities are 1.7 times the value of the sector's equity. They say the leverage ratio is a good indicator of the health of a company or sector's balance sheet and its ability to meet its debt obligations from equity. So given the high cost structure of the mining sector and costs that have to be paid irrespective of mining production, the highly leveraged nature of the mining sector makes one realize how detrimental this lockdown period is, and particularly also any further extension to the lockdown. It seriously prejudices the viability of a number of mining operations. Employment at risk at the moment, it's not really clear. At the end of 2019, we had about 449,000 employees directly employed by mining. And then obviously you've got the backward forward multipliers that pushes those numbers up. In the current 21-day lockdown scenario, we're not too sure how many jobs will be lost, but one must remember though that some companies, particularly those in the ferrochrome companies, had already initiated Section 189. This is the retrenchment process in terms of the Labour Relations Act. So we are certainly expecting some jobs to be at risk during this period. So South Africa, in essence, South Africa is really in quite a bind. Business certainly supports the criticality of fighting COVID-19. I think that has to be emphasized. But South Africa does not have the balance sheet or reserves to implement the type of fiscal stimulus programs that are being implemented in developed or advanced economies. And our recent downgrade to junk status by Moody's, the collapse of the rand, and the higher cost of capital will all undermine our efforts to attract investment and improve the economic growth rate. At the same time, it's critical that the fight against COVID-19 doesn't materially damage the country's economy to the extent that prolonged close down periods end up closing significant portions of the economy on a permanent basis. So this is not an argument for placing profits over lives, rather it's about fighting COVID-19, but at the same time preserving the viability and sustainability of our economy to ensure that we come out stronger than when the pandemic first hit. Now, we are, as a sector, clearly looking at ways of trying to mitigate the impact of the COVID-19 pandemic. We are certainly in engagement with our ministry, trade unions, and even at the country level discussions, say through BUSA, we are looking at putting in place measures to mitigate the impact. And also, but there's no really time to go into it as yet. I can certainly do it during question time. We are also, as a mining sector, combating the impact of the virus. Thuthula Balfour will talk about it, but we're also supporting our communities in that regard. But all these things can be dealt with at a later stage. Let me just end off there.
Thank you so much. Next, we have Dr. Thuthula Balfour, the Head of Health for the Minerals Council. She will address the forum on the impacts COVID-19 has had on the mining sector from a health perspective. Thuthula.
Thank you very much, Aysha, and good afternoon, colleagues. I would like to start off by saying that we need to always remember that we are in constant battle. Man is in constant battle with viruses, each trying to get the better of the other. So, for instance, we have had a number of respiratory, viruses attacking men, and they seem to be fairly successful. If you look at the 1918 flu epidemic, which really caused a lot of havoc in the whole world. So this virus is similar to others. It's in that line where, for instance, around 2002, we had the SARS, which was in China and other countries. We're not as affected as those. Again, in 2009, we had the H1N1 flu, which caused a lot of panic around the world. About 24% of the global population was affected. And there were about 280,000 deaths. So let's compare that to, at the moment, we've got 82,000. And of course, we know that we're still going up. And so COVID now, has about 1,400,000 cases worldwide, and we have 82,000 deaths. So then I say, what is so different? We've had these going around. So what's so different about this, such that for the first time, there's a lockdown in the country? I think it talks to, number one, it's new, there is no vaccine. Luckily, we are in a space now where man usually comes up with a vaccine fairly quickly. So for instance, the last 2002, 2009 epidemics, we would get a vaccine within a year. So again, there's this race against time for us to really get to a vaccine, because then we start controlling the disease. It's highly transmissible. We know that it's even transmitted through talking, at the moment. And it overwhelms health systems if you don't manage it and flatten the curve, which is what all of us have been doing. Part of our lockdown is the strategy of we're flattening the curve so that we don't have our health system overrun and people are dying unnecessarily, and even people who are not even COVID positive, because the hospitals are full and the ventilators are full. So South Africa, I must say, right now we are experiencing this for the first time, in that the other diseases were, yes, in the Spanish flu, the 1918, we were affected. But these other ones, the MERS, the SARS, they were in other countries and we were not as affected. And part of why we are so affected this time is we have a very strong link with Europe, the air travel, Europe, the USA, which is why, for instance, we are going to experience what I call a double whammy, in that we have started off with COVID, which was transmitted from the Northern Hemisphere during their winter. So they had their flu, which is COVID, during a winter season. And these diseases tend to be winter related, which means our turn is still coming. The June, July, the normal period would have had this is still coming, which is why then we are having a major lockdown during a season, out of season, if I can put it like that. And therefore, we don't know what's going to happen in July when the virus, in terms of the, the environmental conditions, flourishes far more. We in the mining industry also have our special circumstances. And I think those circumstances probably also assisted in us being more prepared, than maybe other sectors. And in that, we've got what we call congregate settings. We have people a large number of people who usually work in large groups. Let's say going down, for instance, into the mine, you have a large number of people. And if you've got an airborne or droplets spread infection as we have now, it means then that can happen very quickly. But I also think we have an advantage in that we've got a vast experience with respiratory diseases, pneumonia. Beginning of the century, there were epidemics in the industry, especially for people coming from outside South Africa. And there was high mortality from pneumonia. We've had the TB for quite some time, and we therefore, it's also a droplet and airborne disease, TB, which means the lessons we have from TB we can use for COVID. So in terms of our response, I can say we've had preparation, and we then had what will we do during the disease, and then we are now in the phase of post the lockdown. What are we going to do? So early on, which was around February, we developed a 10-point action plan, which said, how do we prevent? It was more preventive. So education of our workers and contractors on the disease, how to prevent it, the hygiene measures, the cough etiquette, all of those, material was distributed to companies for them to utilize. We also had health worker readiness to say, if we have large numbers of cases of COVID, how will our health workers cope? We, have them educated. And number 3 is the access to consumables. We have right now a worldwide shortage of just about everything. So we hope our members heeded the call in February that get your PPE in now, get all your consumables, your medical supplies, so that when the disease hits us, then you are ready. We also advise them on influenza vaccination because, in fact, 11,000 people die in South Africa every year due to influenza. So we didn't want a situation where around May, June, July, you don't know this is COVID or this is flu. And so we said, as far as possible, people should be on flu vaccines. We also understand, of course, that there is a shortage. So we are saying, according to priority people, there are those people who are more susceptible to influenza, and therefore they would be prioritized. Again, we said, we have, as a country and an industry, high levels of immunocompromised people. Let's make sure everyone knows their status. People must get onto treatment so that they are, not vulnerable at this time when COVID hits. There were other things where we identified, the facilities that would be utilized. We gave travel advice, which countries to travel and how. And also we set up a reporting mechanism. So that was all the things we put in place to be ready. And we then developed a standard operating procedure in March on when there is a case of COVID, then what do we do? And we actually then were looking at things like, making sure that we have clear risk classifications of workers and also of the procedures. I mean, there's a number of procedures we have in the industry which we had to rate as this is a very high risk procedure, this one is low risk. And so if you have very high risk, you need to have almost like, glove, mask, goggles, everything, things like spirometry, which is lung function test we found are very high risk because you are making the person cough. So we also, with the DMRE, Department of Minerals and Energy, we agreed, on how do we then maybe even not concentrate on some of the routine procedures and things we do, but we do targeted we target certain interventions so that we reduce exposure for our health workers. The suggestions on de-densification, masks had to come in because you can de-densify up to a certain level beyond which you can't. So we are really going quite wide on promoting the utilization of face masks for our employees, because in fact, generally, the world over now, the role of masks is becoming very apparent, and also issues of hygiene. So at the moment, we are looking at the post-lockdown period, and we also received guiding principles from the department, which were discussed as a tripartite. So we all had contributions in it. I think I'd like to summarize by saying, two key things that are important in how to address this. The one is collaboration with the public sector. And it's something that doesn't apply just to us, it's the world over. This type of disease, you cannot, it's as a sector in your own corner. We are all in one boat, it's got a leak, and we all need to be seeing, what is our contribution to ensuring that we survive. So we've encouraged our members to collaborate with the district health teams, know what their needs are, assist where they can, and we also believe that in that way, you won't sit in your mind and then you realize there's a case on your mind, when actually if you were with the district people, you would have known that the disease is getting closer to your mind because it's in the community. So that collaboration we are strengthening. We have identified facilities where we will share with the public, facilities for isolation or for quarantine. And we have, some companies have assisted with PPE for some of the health workers in the areas where they work, because there has been this shortage of PPE all over. The last one is, prevention. Our take is that for South Africa, it would be difficult to treat the epidemic. We've got our public health system is not that strong, Even our private sector, you have seen the disaster we have had in St. Augustine's, where health workers and patients were infected in large numbers. So we cannot bank on out-treating the disease. We also do not think that there is a role for testing to ensure that you trace as many people as possible. And so that is something that needs to be supported. I believe that we really need to concentrate on the hygiene, the prevention, the basic hygiene, the utilization of masks. And with that, we might just make it, through the epidemic. Thank you.
Thank you so much, Dr. Balfour. Next, we have Mr. Gaopalelwe Mathiba, a PhD candidate from mineral law in Africa, and he will explain force majeure clauses.
Yeah, no, thank you very much, Aysha. Good afternoon, colleagues and students who have joined. I never expected this large overflow. Okay, so my name is Gaopalelwe Mathiba, and I'm currently busy with my PhD with the mineral law in Africa. I just want to share a brief perspective on how this pandemic gets to interface with the force majeure clauses in quite a number of different and several mining agreements that are there. Now, the first question is, of course, what is a force majeure? A force majeure is a contract law concept which entails that the contractual obligations under a particular contract can at some point, under a very strict and exceptional circumstances, be suspended. The effect is that a person who would ordinarily be obliged under the terms of the contract to deliver certain acts or to do certain things might be absolved from doing that because of that particular unavoidable circumstance, and the party who might be aggrieved as a result of that might not really have much of a relief in turn. Now, for any party who wants to rely on a force majeure clause as an argument, he of course have to prove certain requirements, and one of those requirements is that a party must establish beyond any doubt that he or she was not having reasonable control over the situation. And secondly, that the situation couldn't have reasonably been averted or avoided anyhow. And of course, lastly, that the damage that flows from that non-action is not part of negligence. So those are the key requirements that have to be established for a successful invocation of a force majeure. Now the question then comes: what does this mean? Does COVID-19 really constitute a force majeure event? And I think that has now become something beyond question, given how we have seen quite recently how the global corporate world have come in concert to appreciate that indeed COVID-19 constitute a force majeure, because it's something that no one is having control over, except of course, and needless to say that there are several conspiracies that goes around that. But I think like Dr. Thuthula said, it's not time for that now. Mining industry and COVID-19, how does all this boils down to the mining industry? What does this mean for the mining industry? We all know that a normal operating mining company, it has within, as part of its overall operation, different agreements. We have such as offtake agreements, customer supply contracts, supply chain agreements, mine community development agreements, and many more different types of agreements that a mine company gets involved into. Now, it basically means that due to the COVID-19, the mining companies can be absolved from acting in terms of those agreements. And whoever, be it the contractors, be it the consultants of various mines, cannot have a legal claim or a legal relief against those mines for that. And we have seen quite a number of mining companies that are part of the council, and I think Mr. Chabana will also agree that these mining companies are also part of the council. We have Sibanye Steel Waters, we have Implats, we have Goldfields Group that has, I think it was on Monday when Goldfields has overhauled operations in its South Deep mine, to say that they moved a bulk of its operations to care and maintenance to lockdown. And if to think that as if that is enough, we also have the Royal Bafokeng Platinum that has placed its operations on care and maintenance and instructed a large number of its employees to stay home. Now, what is common with all these mining companies is that despite having reduced its operations this much and having declared force majeure and having saved quite a number of contractors and consultants with force majeure notices, they have said that their employers are still gonna get their salaries. But now, this, I think, the mines, of course, could be able to sustain a 21-day lockdown, but I think anything beyond 21 days could start to hurt. And like Mr. Chabana has indicated, we can expect and project quite a number of retrenchments, job losses, and other economic downturn and all that. So it's a call for concern. And the bigger takeaway that I want to leave with is that at this present moment, for those mines invoking force majeure clauses, the big question that they are seated with is whether or not the lockdown will be extended beyond 21 days. And if so, whether the effect of this clause, the force majeure clause, will also be extended as well. And the answer is, of course, yes, because if the lockdown persists, it means that the regulations for the lockdown will also continue to be enforced, and the precautionary measures will also continue to be enforced, and hence also the force majeure clause will also have to be extended. But one thing that we really have to moderate our thoughts on is that when this virus crisis decides to subside eventually, if ever it decides to, legal battles are anticipated to begin, and it's not going to be quite a friendly experience, but we will cross that bridge when we get there. So that is basically what it means for the mining industry to say that they are more likely to receive in their desks quite a number of summons and documents instituting quite litigious processes and all that because of failure to act according to the agreements and contracts that they have accepted and signed to be bound by them. Yes, that is basically how the force majeure concept and the mining industry gets to interface with one another, and I'll be waiting for any question to flow on that. Thank you so much, Aysha.
Thank you so much for your presentation. Lastly, we have Mr. Richard Cramer, a postgraduate candidate from Mineral Law in Africa, and he will provide an historical account of the smallpox crisis in Kimberley and hint at what lessons we could learn from our past. So, Richard.
Thanks, Aysha. I apologize for not being on camera. I don't actually have a webcam on this PC, but yeah, I'm just going to share my screen with you. So yeah, just so there's something up on the screen. But I was just wanting to talk about the need to not forget history, particularly a history such as ours and our mining industry. As our mining industry doesn't have particularly the greatest history when it comes to responding to pandemics and disease among its mine workers. And due to our particular history and the migrant labor system that developed as a result of it, our mine workers do tend to be a particularly vulnerable group due to the immunocompromising conditions they have picked up as a result, such as HIV and TB. So I think it's necessary to go back and look at how our mining industry has responded in the past to pandemics and disease, to learn lessons about what we shouldn't do and what we should do going forward. And unfortunately, back to our mining industry's very inception with the diamond mining in Kimberley, it's not a pretty picture. So in Kimberley in 1883 to 1884, there was an outbreak of smallpox. Thankfully, smallpox is a disease of which we may speak in the past tense, thanks to a successful vaccination campaign which defeated it. However, for those in the past who contracted this disease, it was not a pleasant experience, being characterized by a rising fever, splitting headache, and blisters in the throat, and a rash that ripened into blisters on the skin, and it killed on average 3 in 10 people who contracted it. And those who survived smallpox were often left with severe scarring, potentially blindness and infertility. And when smallpox came to Kimberley ultimately did not have the best public health system, despite the amount of prosperity one would assume should follow such a significant expansion of mining in a town. And in this case, we had 2 primary villains. These were Dr. Leander Starr Jamison and Mr. Cecil John Rhodes. Although they were not the only culpable parties by any means, they were the most prominent among them. So a few migrant workers arrived in Kimberley showing signs of smallpox. They were initially diagnosed by Dr. Jamison as having smallpox, but then he decided he was going to retract that diagnosis and claimed that all they had was a non-lethal and non-contagious skin condition. And despite the medical board reaching the conclusion that quarantine of the migrant workers was necessary, Jamison and some like-minded doctors proceeded to conduct a campaign of misinformation, distributing flyers which denied that those migrant workers who had been quarantined had smallpox. Having close links with those in the diamond industry was likely a motive for people like Jamison to try quell any panic related to smallpox. However, it was most likely the powerful elites such as Rhodes who wished to avoid the closure of Kimberley's diamond fields, who were the real power in facilitating the cover-up of the outbreak of smallpox. Rhodes himself insisted that the disease that was spreading in Kimberley be labeled chickenpox. It's not possible to go into all the sordid details of the conspiracy between the diamond elite and the compliant medical professions, but the downplaying and outright denial of the existence of smallpox in Kimberley had catastrophic consequences. And while measures were eventually taken to quell the outbreak, there was ultimately a very high mortality rate, with about 700 people dying of smallpox in a town of 20,000. And what this contemptible episode in the history of South Africa's mining industry demonstrates is the need for absolute transparency in a time of crisis. I'm not suggesting that we can expect a conspiracy such as we saw in Kimberley in the 1800s in our modern mines, but it's still an important lesson to keep in mind. And we need to keep in mind the mistakes the industry has made in the past so that we can learn from those. And we do need to remind the industry of its past mistakes. So it is hoped that ultimately transparency will prevail, absolute transparency will prevail in our current pandemic. And yeah, I think that's all I have to say. Thanks, Aysha.
Thank you so much. Okay, we've got quite a fair amount of questions to get through, and we've got about 15 minutes left on the official kind of time of the forum usually, but we do have a bit of wiggle room, so people are more than welcome to just stay on if they can, and if the panelists wouldn't mind maybe stretching it on for another 10 or 15 minutes, that might help us get through a lot of these questions. One of the first questions I received even before the meeting started, it's from Elise, is COVID-19 likely to influence a paradigm shift in terms of prioritizing national/regional beneficiation going forward, rather than the export of raw materials from the SADC region for beneficiation purposes? I'm not sure which of the panel would like to address this question. Is there any takers?
Yeah, I'm certainly willing to do so quickly. I don't think COVID-19 itself would have that impact. And unfortunately, I think the challenges with us being able to beneficiate on material would still be there. I mean, I mentioned the ferrochrome producers in the position at the moment where they are nearly all of them issuing Section 189 retrenchment letters. They are engaging with government to talk and other chrome producers to talk about reducing the export of chrome itself and rather beneficiating it in country. And every single one of us understand the main stumbling block to us doing so is the price and availability of electricity. If we cannot resolve something like as critical as that, there is no way that we can continue to beneficiate our chrome, and our ferrochrome capacity will continue to dwindle. So I just want to say, in many instances, we would want to actually further beneficiate certain minerals, but just due to circumstances that we absolutely cannot. And we shouldn't also underestimate the importance, though, of still exporting raw material. For instance, chrome. As I said, the mining industry provides that primary income, the cash flow, is a main producer of cash flow for the country. I told you about 45% of export and 25% through primary minerals. So the country still needs the money from those minerals, even if some are not beneficiated.
Here's another question for you, Mr. Chabana. How do we expect the energy sector, particularly Eskom, to respond to the rising energy demand once the lockdown ends? Should there be harsher load shedding measures?
I think we all forget that just prior to this pandemic, we were dealing with the other crisis of Eskom, and which has not been resolved. I think COVID-19 has taken our mind off it for a while. So we're still sitting with a major problem with Eskom. All I can say is that we are certainly hoping that Eskom is utilizing this period of reduced activity in the economy to do things like essential maintenance and get its act together. Now, we've heard that they are doing so, but mind you, there was some mixed messages though. So we are hoping that at least Eskom will be able to come out of this stronger for having done some essential maintenance to be able to carry us through for a while. But I think, make no mistake, I mean, even when we come out of the crisis, there will be reduced production and certainly, and also less demand on Eskom's power.
Okay, thank you. I'll just grab another question. This is generally to the Minerals Council. Given South Africa's intention to build a huge number of respirators before June, usually locally sourced materials, which parts of the minerals sector do you think will be roped in to provide raw materials? Does this present an opportunity for easy transitions in terms of productivity?
I think I'll try and answer that. I'm not an expert on respirators and what materials you need. I mean, I know for cars, you need minerals. So I'm not sure how much minerals you need for respirators, but it probably is not a huge amount of respirators that would be required, you know. So we'll see. We haven't had any knock on the door on the mining sector regarding the respirators. I don't know if you want me to carry on and answer some of the questions I picked up.
Yes, yes, please. There's two others that I specifically think relate to you. If you could read them out, or I can read them out and you can answer them.
One was, how does the flu vaccination help? The flu vaccination helps in two ways. The one, for people that are compromised, you know, diabetics, people with even asthma, you know, chronic lung diseases, then you want to make sure that they don't get two viruses. They don't get a flu and then they get COVID, because one of them might take them out. So you would want to make sure that at least the flu is out of the way as far as possible. I'm saying as far as possible because flu is not 100%, it's about 60% protective, because, you know, various strains rotate. And again, the second reason is that if you have immunized the person, you are at least partially certain it might not be flu, and therefore you are more focused on COVID, that the person has COVID rather than flu. The other question was, what are the specific lessons we have got from our, you know, older diseases like TB and would apply in COVID-19? We've managed, in fact, I'll also answer the one about how we're doing with TB and HIV. On TB, we have done very well. In the last 10 years, we've had, you know, massive programs on reducing TB. We've got a target that the industry must be at or below the South African incidence. And if we look at the total industry, we are around the incidence in South Africa. It's only in the gold sector that we are still just above the South African incidence. So some of the ways, because both diseases are airborne, so the mechanisms for control and monitoring are similar. So screening, for instance, we've been doing a lot of screening, cough questionnaires for TB, which means the same now. We're doing cough questionnaires, which will be for COVID, and temperature checks, you know, health monitoring in general, it's something we've been doing fairly well. Also, the health staff, you know, our staff is used to managing TB, which is as infectious as COVID, which means that in terms of protection, you know, they are more ready to protect themselves. And then also the reporting, there is reporting on COVID-19 and the same with TB. So, and like I said, generally both are lung diseases, which means that there's a lot that we have learned from both. The other one, last I will answer just before then you take over, is the transmission through talking. You know, we've learned a lot as we go along in this epidemic. It started off as droplets which fall on surfaces which you touch, and then you touch your face, and that's how they get to your mouth and your eyes and your nose. Then it became, no, this thing, you know, it's airborne. That was in the last 2 weeks that it's accepted that the particles float in the air, similar to TB, for some time, and therefore in places where there's poor ventilation, you can go into a room where someone left, but you still can get, you know, the virus. And again, they found that when people are talking, the 1 meter, you can, you know, within the meter, a person can talk to the extent that the saliva, which is spit out, which is why the question of universal mask, you know, utilization of masks by the general population is coming through now very strongly. And even the Asian countries that have survived this better than the US and others, the utilization of masks was very high in those countries. So it's something in South Africa that we need to seriously consider. Thank you.
Thank you so much. Oh, go for it.
Yeah, just I want to address something before I get to the question, and this is just to Mr. Mathiba. Thank you for your presentation. There is just one thing I do want to clarify, though, that yes, a lot of mining companies have utilized force majeure relating to contractual obligations. but especially with a large contract, I have seen though instances though of mining companies with some of their smaller suppliers and the like continuing to pay their suppliers just so that they can pay their salaries. So this hasn't been a blanket utilization of force majeure where it was required. So that's important. But the most important thing I just wanted to add though is to make it clear the social obligations that mining companies have towards their communities in terms of their socioeconomic development and the like in their social and labor plans is not a contractual obligation. It is an obligation in terms of their license. So irrespective of what you are doing as the mine, i.e. whether you are producing, whether you are carrying on your business as usual, you have those obligations to continue with your SLPs. So I just wanted to make that absolutely clear that those social obligations do not arise from any contract, but from the law, the legislation, and that's how they arise. The other issue I just wanted to touch, I think this is one of the questions relating to social protection of employees. As we basically said, I mean, we think the payment of salaries to employees is one of our biggest contributions that we can actually make to not only our workforce, but also those communities where we are operating. Paying those salaries is absolutely essential. However, mining companies that are not in production, clearly their ability to be able to pay salaries is severely curtailed. So the best protection against that is actually, well, the best protection against their income drying up, the best protection against the country's cash flow drying up is to continue mining, but certainly utilizing the preventative controls that are necessary, the social distancing. And it is absolutely possible to do so. I mean, if you look at some of the iron ore mines, I'll mention one by name because I used to work for them. If you look at Sishen Mine in the Northern Cape, I mean, you've got one person driving a massive, massive truck, and you know there are no other people around. It's very, very highly automated, so you can actually continue production. You know, 100% of production. It's actually in the offices where you would need to do the social distancing and do that carefully. So there are many operations that could continue while still, without undermining the national objectives of trying to combat COVID-19. I think that's important. But as to whether that will happen, clearly there is, as you know, there's already a discussion with government as to, well, what happens after, the 17th of April? Will it be extended, the lockdown? And to the extent that it is extended, what does this mean for business? So those discussions are actually taking place. I'm not too sure. Maybe leave it there for now.
Okay, thank you. We have a question for Richard. Richard, can you hear me? Are you still there?
Sorry, I was muted.
Okay. So we have from Henry, the Jamison who made the decision about rebranding the disease. Is that the very same one whose actions started the South African, aka Anglo-Boer War, with that intervention into the old rand?
Yes, it's the very same Jamison that even today, whose name is attached to UCT's transport system.
Sure. Okay.
Hello, Aysha.
Hello.
Can I just quickly step in and maybe just to thank Mr. Chabana to clarify on that. But I think the point that he might have missed is that I do acknowledge and appreciate that the mining companies, more especially the Royal Bafokeng Platinum, I was reading this article where they made an assurance that the small suppliers, they will be given something like an advance to sustain themselves moving forward for a period as long as this thing lasts. But now the concern, and I did mention this to say that, yes, I agree, the mines could be able to sustain a 21-day lockdown. But now, inevitably, as and when we go forward, anything beyond 21-day lockdown, it might hit hard on their pockets. And of course, now the question that comes will then be the contingency to say, are there any contingency plans for those small suppliers? Should the lockdown be extended until we don't know when? Will the mining companies, those who have made an assurance that they will give advances to the small suppliers, do they have any contingency strategies in place for them? And insofar as the force majeure application is concerned, whether it is whether the obligation derives from the contract itself or the statute or the legislation, that is quite immaterial, because at the end of the day, it is an obligation of the mine that needs to be fulfilled, be it coming from the contract, be it coming from the mining license as one of the requirements or the conditions that it must meet, be it coming from the statute, the national legislation. That distinction is really quite immaterial when it comes to whether or not force majeure or not. I just wanted to clarify that and bring it into a clear context. Thanks, Aysha.
Thank you. So we have a general question to all. Are any measures being put in place to manage the potential transfer of infection between mining areas and the so-called labor sending areas? I'm not sure to what extent this movement is still directly managed by the industry.
Okay, this is something I feel very strongly about, and which I lost in terms of my views. When the lockdown was announced, we tried to discourage people from leaving because Gauteng was the epicenter, Western Cape was the epicenter, as well as Natal. Now, most people in mining are from labor sending areas, the other Lesotho, Botswana, Mozambique, Eastern Cape. Now, imagine all the people from Western Cape and from Gauteng going to Eastern Cape, and those are high transmission areas. But unfortunately, I don't think it's something that a lot of people left, and it is understandable. 3 weeks away from family over Easter, knowing that you will not see them again for maybe till the next term or the next half of the year. I think it just shows, the conditions under which our people work as migrants. So people did go home. In some instances, they were turned back. I think there were countries which sort of said, no, people must not come back, because they felt then they would be more exposed. So at the moment, really, the general advice had been that people should try and stay where they were. There isn't a lot of, we aren't so involved now in the transfer of miners. As I have indicated, we had our position, but it was not as effective as we would have wished in terms of a health perspective, but maybe at a social level, it was good for the people to go home. Thank you.
Okay, we've got another question here. Will the impact of COVID-19 possibly be the reduction of the curse, the resource curse phenomenon in the developing world? I think it's quite a deeply philosophical question, actually. So if anyone wants to tackle that from the panel.
I think we're a bit afraid to tackle this one. I mean, the resource curse has so many implications to it. Yeah. So
well,
I think have to be more specific which element of that resource, because it's the fact that we have the minerals. There's the component of not beneficiating. I think we've touched on that. There's the element of it's having an impact on your currency. There's so many elements to it. I don't know.
There's another question somewhat related. At least I see it as slightly related. Will we leverage / lean on China to support with supply of medical equipment, since they have the highest demand of our resources and supply of health and safety products, and considering their demand for our resources? So is our relationship with China going to be relied on this time?
Maybe if I can come in. We have, that's an interesting point to consider. We as the Minerals Council have not really considered that angle, but I hope certainly that government will consider that angle. Certainly, I mean, we are part of BRICS. I do believe recently we went and gotten some money from BRICS Bank. So I'm hoping that that relationship will be leveraged not only through just the financial resources of BRICS, but also, as you say, getting China to provide us with the medical equipment and the like. But I'm not aware of this actually taking place.
I just wanted to reach out to the participants. If you have specific things that you want to vocalize, or have questions that I haven't addressed, I might have just missed them. There's quite a fair amount of them. Please raise your hand or unmute yourself and just introduce yourself to briefly speak on whatever issue you feel has not been spoken about today.
Hi, this is Harold Anagon. I posted quite a long comment question that hasn't been addressed. I can't quite see where it is. Perhaps you can scroll up and find it.
Do you want to speak on the point, or would you like?
Yes, the time was at 2:32. If people want to scroll up.
You're also welcome to take this time to just ask the question.
Okay. Post the lockdown period, when workers return to the mines, many of the workers are resident in informal settlements surrounding the mines, where they are lack of basic hygiene and sanitation facilities. These workers thus represent an ongoing hazard of transmitting the disease back into the workplace. Are the mines considering any urgent measures to install hygiene and sanitation facilities in the informal areas where their workers are resident to stem this ongoing threat to the health of the workers and the communities? Over.
I can come in here to say, interestingly enough, as we mentioned, mines have these social and labor plans where they talk to the kind of social development things they'll be doing within their communities and labor sending areas. Interestingly enough, by far the majority of our spend in these SLPs relates to infrastructure. It's close to 60–70% of our spend relates to infrastructure. Now, why is that so? Our SLPs, our social labor plans, have to be linked to the IDPs, the infrastructure development plans of the local municipality. So as a mining company, you want to mine in this area, you've got to get projects from your local municipality. They tell you, do X, Y, and Z. It's not up to the mining company to unilaterally decide that they want to build a school or do that or do that. So it's got to be linked to the IDP, and it's a municipality that really actually dictates what the mining company must do. So as a matter of fact, the majority of them relate to this type of infrastructure that relates to water, sanitation, pollution facilities, those kind of things. So, however, be that as it may, with the advent of COVID-19, we've been engaging the DMRE, our regulator, to say, hey, we've got these social labor plans in place. They're 5-year plans. However, we have a pandemic of, unknown proportions here. Allow us to make amendments to these SLPs to try to specifically combat COVID-19, through specific and other measures that will combat COVID-19 in our communities. Because you're right. I mean, the hygiene and component. I mean, that's that's the first fight that you actually have to do. Provision of water relating to COVID-19. So that is also, we're under discussions with the DMR at the moment also to focus our SLP spend on combating COVID-19. I think maybe it might be useful also for Thuthula just to come in terms of the measures that we're going to take for when our workers do come back to our communities and to our mines, what we're looking at to ensure that they aren't infected, so to speak.
Okay.
Okay, Mark, come in briefly to respond to that, because you have outlined exactly what the problem is, that the municipalities are not ever going to catch up with a waterborne sanitation, which, as you rightly point out, is dependent on integrated resource development plans, which take 2 years in the planning and a minimum of 5 years in the implementation. We're talking about a pandemic with a 5-day doubling period. You're still mentioning that we have to comply with 5-year development planning. That is exactly the problem. You're talking to the minister. Are you talking to the communities, what they themselves prioritize? And we are, in fact, having a discussion with the Minerals Council tomorrow morning with proposals for low water or waterless sanitation solutions that can be developed in short term, independent of the political processes, because if we do business as usual, waterborne sewage will take 5 years, if ever, to reach and solve the solution. That's why I posed the question, what is being considered now in the light of COVID as an urgent response to what is now a very serious, obvious problem? Over.
Yeah, so if I may just add, Harold, I mean, so there are a lot of short-term measures that mining companies have implemented. I mean, so a lot of mining companies have immediately diverted essentially CSI-related funds to combat the disease, and Thuthula can come in here. I mean, for instance, just sticking with water, let's give example, Anglo American, they are providing water now through actually water tanks as an emergency basis to 69 villages. I mean, this is just an example of an immediate measure that is being undertaken. There's quite a long line of interventions that the mining companies have immediately implemented. We've got a shopping list like you will not believe from various municipalities where our mines are operating. We are working with local municipalities as we speak to try to help them get some of the equipment that they need to try to resolve some of the problems that they have. I think amending social and labor plans, I mean, remember, this is where by far the bulk of funds we do have. We're also trying to ensure that those are also diverted to combating COVID-19 and related issues. So Harold, I mean, very, very welcome to have that discussion with you offline, as in what else we can do, but I'll hand over to Thuthula.
Okay, Harold has a very big point. We've been caught napping as a country because the key prevention measure is hand hygiene. And if there's no water, so I won't go into those provisions, how water is being provided, but because Tebello has touched on that. But also our message to our members on the health side has been, you can't wait for the cases to pop up in your mind. You need to be out there in the community, to be linked with the district, to know what is happening, to assist where possible, the health workers with PPE, with contact tracing. Because if you help as much as you can outside the mine, then you are going to prevent, the disease getting to your operation. So I think a lot of the companies are heeding that, and they are looking at how they, cooperate with the departments, in the communities. Thank you.
Hello. Hi, this is Nazipo January Badul. Can you hear me?
Yes, I can hear you.
Hi, I'm sorry I joined very late because I was in other conference calls. There are 2 points I wanted to respond to, and thank you for the invitation to participate. I sit on the board of AngloGold Ashanti, and I also am the chairperson of the United Nations Global Compact. What we have done at the Global Compact is to invite all private sector companies, because the Global Compact focuses largely on the private sector within the UN agencies. And we've started a newsletter where we have just invited companies to say how they are responding to COVID. And so if you go into the website of the United Nations Global Compact South Africa, you should get a list of all kinds of activities that companies are doing to respond to COVID. And this includes the mining sector. AngloGold Ashanti has made available 2 hospitals that have been that have been mothballed, and literally reconfigured them and retrofitted them to respond to COVID, largely in the interest of communities, but also mine workers. And I know for sure that Anglo America has also posted some of the things that they are doing. Sasol has posted some of the things that they are doing, as well as Royal Bafokeng Platinum and so on. So if you just go into that website, you should get quite a bit of information about what the private sector is doing, besides the very public issues around setting up the Solidarity Fund to make sure that workers are not left stranded throughout this COVID lockdown. And then secondly, I believe that a lot of universities are engaged in trying to find solutions to the shortage of sanitizers, masks, and so on, what they call these PPE products. And certainly the Nelson Mandela University, whose council I also chair, is working quite closely with universities across the country to try and find their own solutions to contribute to either their provinces and also at a national level. The ICT departments are designing all kinds of interesting apps that will contribute to tracking people who are affected and making sure that they have access to public health facilities. Once again, I think there is a dearth of information that is not getting through to the public to actually describe how institutions are responding in very innovative ways to this big challenge. And perhaps what we need to do from the mining, from the Chabana and your team, Tebello, is perhaps to find a way in which the information can be disseminated and it doesn't look as if there's no response. I know that the universities are working very well with one another to try and find very practical, down-to-earth, accessible solutions to making various products available, including designing our own, because I think the formula for making these things is actually not as complicated as they might seem. And yes, China will always be there as a friend, but we're going to have to take care of ourselves. And maybe I think it is actually unleashing innovation within the country. And people are not sitting back and doing nothing. Thanks.
I just want to
I have to leave. Sorry.
Okay, thank you so much, Dr. Balfour, for joining us.
Thank you.
Okay, thank you.
I just wanted to add to say thank you to Nazipo, because you answered my question. And I think you made a really good recommendation for particularly maybe the Mineral Council to put out some announcements as to how proactive the mining companies are actually being in terms of protecting workers and communities against the virus, whether that be making hospitals available or going in and assisting with testing, etc., etc. I think that would be really useful to get that out into the general public.
Right. Okay.
Thank you. I have tried to collect as many questions as possible, but they're coming in all the time, and we're about 20 minutes over the meeting time. So I think that what I can do is this recording will be made available online, and I can send the remaining questions to our panelists to contribute and answer, and then I can send an email out just distributing their answers to the remaining questions that haven't been answered, and then the chat will be made available as well. If there's any last minute comments or things that really like are testing and you want to mention them now, please feel free. We have about another, I'll give it about another 5 minutes, if that's fine.
And yeah, Aysha, from our side, please, if you don't mind raising the questions now, even though we are in lockdown period, it's a crazy busy period due to the negotiations taking place, especially relating to what the president's going to decide over the weekend. As you know, there's a cabinet meeting to decide whether or not they extended the lockdown period or not. So it is quite a busy period. So I do welcome the questions to come now, if you don't mind.
Oh, okay. Okay, let me rather than just read them out loud. Is it true that the SLP spending by mining companies is significantly lower than the percentage social spending imposed on renewable energy IPPs, independent power producers? Tebello, can you hear us?
Sorry, I was going on on mute. Sorry. I was saying that I have not quantified the amounts that the renewable guys have been spending on the social development. So I'd love to hear what it is. But just to give you an indication of what the mines are spending. Now, you know that I guess the international norm is that you should be spending what 1% of NPAT on social development. I mean, the analysis that we did for our member mining companies, we did this, and the initial report we did in 2016, it's on our website, and also I think the 2019 report. You will see that mining companies are spending way in excess of that 1% of NPAT. Even companies that are not in production, for instance, I mean, if you look at the Ivanplatz mine, that's still at a drilling stage. Ivanplatz mine, they're spending 300 million rand on social development, and yet they're not, making a single cent. So even companies without any profit are spending money on community development. My understanding is that the figure for last year by our member companies was in excess of 2 billion that was spent on social development. I can only give our figures. I just don't know what the renewables are spending, but I'd love to see that data.
Okay, thanks. And then has the department changed its stance from last week, as they were not in favor of amending SLPs?
Sure. Yeah, we are in discussions literally as we speak. We did have another meeting with the department on that. You're right, they're not in favor of amending SLPs. I guess on the one hand, it's understandable in that these SLPs do take quite a while to be put together, negotiated, consulted on with the respective communities. So now here you are coming now with, due to the pandemic, wanting to change things. However, we're saying to the department, look, it's not as if companies, what they want to do is unilateral. As Thuthula said, and I've seen it myself, we are engaging, I mean, our people in the mines are on the ground engaging with the municipalities literally on a daily basis. So we've got an understanding of some of the challenges that are on the ground. A lot of municipalities are really totally incapable of dealing at the moment with the pandemic, and they are certainly not prepared. So we are trying to see what we can do to try to help them. But one of the things that we are trying to do is work together to understand what it is that we actually need to combat COVID-19. And then jointly essentially say to DMR, this particular company, they've been engaging with the municipality. This is what they actually want to do. Can this particular initiative rather be offset against something else that they need to do? Let's prioritize this to combat COVID-19. So we haven't given up on that discussion with the DMR.
Sorry, I was still muted. My dog is scratching at the door very urgently. So, how is the council looking at supporting its members to weather the storm?
Look, we're an advocacy organization, so we aren't in a position to provide many services for our members. But so what we have been trying to do is essentially just lead the charge in terms of, firstly, what they should be doing to combat the pandemic. I think, Thuthula Balfour went into quite a bit of detail as to what we've done. I mean, we started right in the first week of February, we were already disseminating information to our members on what to do before it actually, the virus came to South Africa. So I'd like to think that we've been very proactive in that regard, looking at what the World Health Organization is saying, putting material together, informing our members what it is they need to do. And then I think also of late, working with our members to make resources available, such as conversions of hospitals, providing beds, not only for employees, but obviously for community members that require isolation. So we've been trying to coordinate those kind of efforts. And then also, quite importantly, the negotiations with government relating to how the lockdown period should be implemented, or how should some mining continue during the lockdown period in terms of essential services and minimal production. We've been at the forefront of engaging government on that on behalf of the industry. So I think we'd like to think that we're playing our part.
If the lockdown is extended, as many are forecasting that it will, what will that mean for deep level underground mines?
As we said, the deep level underground mines at the moment are closed. They're in care and maintenance. We would ideally want the situation where some mining can be restarted, but I think everybody understands the big challenge that you have for deep level underground mines. If you think of, countrywide, the various hotspots for relating to COVID-19, the real areas that worry you, it will be public transport, it will be squatter camps. Level mining is right up there with it, because you've got 40 people, for instance, in this like a cage elevator. One person coughs and you're really impacting so many there. Whatever happens, even if we allow to continue production of some of the deep level mines, it will have to be with strict adherence to social distancing. So deep level mines, if they are allowed to restart production, will have to really rethink how they do what they do to ensure that, that people are protected. Now, this is a big challenge for deep level mining, especially those labor intensive ones. It's going to be very difficult for them to separate people and enforce social distancing. But I think it's possible and it can be done. Unfortunately, it will certainly entail lower production, but certainly with much less people. So those are some of the challenges that they're going to have to deal with. The open pit mines are a lot luckier, I think, and not easier to manage social distancing. But the deep hole mines have a challenge.
So I have 3 more questions, and then I think we can call it a day. If that's fine with you, Tebello, I think that most of them will be directed to the Minerals Council. What is the one thing we are not doing as a country that would have a significant impact on the way we deal with this pandemic on a national level?
Sure. Would have preferred Dr. Thuthula Balfour to answer that one, but my simplistic view at the moment is testing. That is certainly something that we are not doing that is critical, not doing on enough of a scale and large enough scale. I mean, we've seen how countries like South Korea, it wasn't a matter of shutting down the economy, but rather just testing as many people as possible. So I think the one thing that we're probably not doing enough of, but look, I think we all understand the constraints in terms of test kits. The whole globe, the whole world is wanting these test kits. They are in short supply, and those that have big monies are able to muscle their way into, into shipments, so to speak. So it's a big challenge. But if there's one thing, I think it's testing.
Thank you. South Africa has been the recipient of dwelling investment into brown and greenfield projects. Can the COVID-19 situation be used to turn this situation around to the benefit of South Africa?
So I think it's been the victim of, I think, dwindling investment into greenfield.
The recipient of dwindling investment.
Absolutely. I mean, look, we don't even receive more than 1% of the global spend on exploration. For a large mining jurisdiction, I mean, we should be up there with Australia and the likes in receiving way in excess of whatever 5% or so of global spend. So, and of that 1% that we are receiving, the majority of it is on brownfields exploration as opposed to greenfields exploration. Now, how will COVID-19 help us? So this is actually one of the things we're putting together for the department. Once we come out of the lockdown period, okay, understand that during the lockdown period, it's important that we at least allow economic activity to take place. But I certainly think that once that's all done and we're back to the normal inverted commas, you would rather say the new normal, one of the things that we actually have to do is stimulate investment in the mining sector. And exploration is one of the big ticket items that we want to push. We really do want government to relook at some of the regulatory environment. We want them to look at certain measures to allow things like flow-through shares. The 12J allowance is not working. Let's have a better flow-through share regime. Let's strongly encourage exploration in the South African context. I know Council of Geosciences is going to be spending some more money on mapping the country. So I really do think that a lot can be done post this COVID pandemic to try to stimulate investment in South Africa, but in particular in exploration. And that is one of the things we're looking at.
There's 2 more questions that I think might be worthy of just quickly touching on, if you're fine with that. Otherwise, I can send them to you for later. Are you still available for the next 5 minutes or so?
Yeah, maybe the time is ticking now. So maybe now, yeah, you can.
Okay. Last question. Where can we find the latest information about the Minerals Council response to COVID-19?
On our website, we've got a COVID-19 landing page. So what we've done is material, and those are some of our members that they've shared with us. We've put that on our website. Just go on the Minerals Council website and you'll see it there. What we haven't done well enough, I think, Zipo mentioned it, and I think also Jennifer mentioned it. We are not doing enough to make the public aware of what we're doing as the mining companies to combat COVID-19. In particular, what we're doing in our communities and for our own workers. That is something we need to get on to as soon as possible. So you won't find much of that material there, but there's a world of information on our website.
Okay, thank you so much for joining us, and everyone here, the participants, thank you so much for your very insightful questions. There are 2 last questions that haven't been answered, and I will try and do my best to answer them myself at a later stage, do some research. But otherwise, thank you so much for being here. Thank you.
Thank you, Aysha.
Thank you, Aysha.
Thank you. Thank you.
Thank you, Aysha. Well done. That was great.
Thank you. Excellent.
Well done.
Thank you, Aysha. Well done.
Bye, Jenny.
Bye-bye, Nuzipo. Bye.
Bye-bye. I'm so sorry I joined late, but anyway.
Oh, it was great. Your comment was spot on. Thank you.
Thank you.
Bye.
Okay. Bye-bye. Thanks,
That was
Aysha.
a very insightful, informative session. Your Aysha, very nice and both. Could you not have a part 2 discussion next week?
Well, we have the next webinar. I should probably have plugged that a little bit earlier, but yeah, I will be sending numerous spam messages about the upcoming sessions with different topics.